Hello everyone, I'm Dr. Zaid. I'm a prosthodontist and a consultant implantologist. Today let's talk about what oral health is and the implication of oral hygiene in the maintenance of a healthy oral environment. A lot of us correlate oral health to just having a beautiful smile. Believe me, it's much more than that. It's about maintaining healthy teeth and gums which directly and indirectly impact your overall health. I cannot emphasize enough on how important oral hygiene is in preventing various dental disorders, gum diseases, the most dreadful one being oral cancer. Let us now talk about the various disorders that we as dentists encounter in the oral cavity on a daily basis, and what are the do's and don'ts to prevent them. This brings us to the most common dental disorder that we see every day is dental caries or dental decay. Having said that, it is also one of the easiest disorders to prevent. What are we supposed to do? Proper brushing and flossing as an adjuvant with the usage of proper mouthwashes, especially chlorhexidine, twice daily is all that it takes. Secondly, the next disorder is gum diseases, which is also called as periodontal disease. Again, a debilitating condition which leads to rapid loss of teeth. How can this be avoided? Same again, by using proper brushing techniques, by using flossing as an adjuvant to brushing, by using mouthwashes, preferably chlorhexidine at least twice daily. So this brings us to one of the most dreadful conditions in the oral cavity, rather in the entire body, which is cancer. The incidence of oral cancer has risen exponentially in the last few years thanks to the increased incidence of tobacco consumption. It is a potentially life-threatening condition which claims millions of lives every year. The key to the successful treatment of oral cancer lies in early detection and early treatment of the lesion. So regular dental checkups is the most important tool which we have to combat such dreadful diseases. So now this brings us to the question, how do we maintain a good oral hygiene? It is very simple. I've already mentioned it before. Proper brushing techniques, using circular strokes while brushing rather than using horizontal strokes, by using flossing as an adjuvant to brushing, by using appropriate mouthwashes, by avoiding any form of tobacco, be it BDs, cigarettes, gutkhas and whatnot, by avoiding acidic foods and drinks and processed sugar. Bleeding gums is not a reason to stop brushing. In fact, it merely indicates that there is a presence of gum diseases, which again can be prevented easily by proper and regular brushing. So I conclude by saying that prevention is better than cure, and this holds very good to oral diseases as well. A lot of people tend to say that dental treatment is quite expensive, which is not true at all. The maintenance of proper oral hygiene is the single most important tool which we have for the prevention of any kind of oral diseases. So having said that, maintenance of proper oral hygiene is not expensive at all. A good diet also plays an important role when it comes to oral hygiene. There have been newer advances which can be used to maintain oral hygiene. Lastly, I would conclude by saying that dental treatment is not expensive, but neglect is. Thank you. Have a wonderful day.